Hello, welcome to the Mayo Clinic. My name is Dr. Michael Edwards. I am a Senior Associate Consultant in the Department of General Surgery. Our patient today is a 39-year-old female with a large suprapubic incisional hernia. She is an unfortunate lady who underwent a C-section that was complicated by hemorrhagic shock, resulting in heart failure and end-stage kidney disease. She presented to me with complex a bulge in her pubic area that was associated with pain. Examination confirmed a suprapubic incisional hernia that was confirmed also by CT scan. Our hope for her today is to perform a robotic-assisted transabdominal preperitoneal repair of her suprapubic incisional hernia. If you all are ready, let's go and see what we find.